Making sure people get vaccinated is not the only concern right now. The rise of variants could also keep us locked in the pandemic. The Oregon Health Authority is monitoring 8 different variants, totaling nearly 800 cases.
Oregon Health and Science University did a study on some of these variants to see if vaccines are effective against these new mutations. Joining us live to break down those results is Dr. Marcel Kurlan, an associate professor of medicine at OHSU. Good morning. Thanks for joining us.
Good morning. Thank you.
So tell us about this study into some of these new variants and mutations of COVID-19. What did you find?
Sure. Well, the immune system responds in a couple of ways to threats. One of them is the production of antibodies. So we essentially took people who received the Pfizer vaccine and just looked at how well they responded with antibodies against the original strain of the virus, which is how the vaccine was made. And then we also looked at how those antibodies could neutralize the new variants, the 2 most common variants of concern that are circulating in the world.
Okay, and so for the layman, what does all this mean to our viewers out there who the medical language, sometimes it gets a little confusing?
Yeah, I mean, the bottom line is, will the vaccine protect you against the virus strain we have now? And then we've all heard about these mutations and new viruses that are changing. So the question is, will the vaccine protect you against these new viral strains that are coming up? That's really the bottom line.
And what were you able to find on that? Is there some level of protection for some of these mutations?
Yeah, the news is good. So we found that almost everyone makes antibodies to the original strain, and they also make antibodies to the variants as well. So that's great news. We did find some caution in that story, though, because the level of antibody protection against the variants is a little bit lower than against the original strain. So what that means is we still are getting protection from the vaccine against the new strains that are circulating now, but the threat of additional new strains coming up that could become less and less responsive to the immune responses from the vaccine is really there. And that underscores the point that we really are in a race against the virus, because we need to get more people vaccinated before the virus has a chance to mutate and create more dangerous strains. Basically, the more people that are infected, the higher the chance that we'll get mutant strains coming up.
Okay, and so do we, because we have seen several of these variants, do you expect to see even more, like what you were just saying, as they continue to mutate? And again, how does age play a role with these variants?
Right. So we are going to see more. We are going to see more strains, mutant strains come up. That's just the natural biology of viruses. And the way to address that is to reduce the number of people carrying the virus so that it reduces the fuel on that fire. As far as age goes, there is a distinct change in the antibody response to age. We can see it very clearly. The older you get, the weaker your immune response to the vaccine. But again, the good news there is that regardless of your age, for the most part, you still do develop a response. So these findings are interesting. They provide us some insight into how things work, but they underscore the need to continue to get vaccinated.
Well, of course, you have this warning and this research here as we're starting to see more and more pandemic fatigue. People are getting tired of this. There are people saying, well, there's a light at the end of the tunnel because people are getting vaccinated. I'm curious, what threshold do you think we need to see in the community in terms of vaccinations for people to actually be able to let their guard down safely?
Yeah. Well, everyone, of course, wants to peel the masks off, myself included. We talk a lot about herd immunity. Some experts say between 70 and 90% of people with immune responses that work would reduce the spread of the epidemic to acceptable levels where the risk is low. That's a number that epidemiology experts throw around. But the key, right now, about half of the American adult population has received at least 1 dose. That's not good enough yet. We need to get to much higher levels.
All right. Well, Dr. Marcel Kurlan from OHSU, thanks for joining us this morning and helping to break some of this down.
Thank you so much.
And to track the coronavirus in your county, we have all the latest. We're tracking numbers on coin.com. You can see daily updated case totals and the latest restrictions.
We have new details about a plane crash that killed